If you're over 60 and you've ever looked at your blood pressure reading and wondered, which number should scare me more, the top number or the bottom number? You're not alone. Because here's the truth. Depending on your age, your symptoms, and how high the numbers are, one blood pressure number can be far more dangerous than people realize, and many seniors focus on the wrong one. In this video, I'm going to break down which blood pressure number is most dangerous after 60, what thresholds matter, and the one situation where the dangerous number is not the one you think. And stick with me, because near the end, I'll give you a simple checklist for what to do the next time you see a high reading without panic. Most people are taught 120/80 is normal, but once you're over 60, a few things happen. Blood vessels often get stiffer with age. The top number may drift upward. The bottom number might stay the same, or even trend lower. And medications, dehydration, or heart rhythm issues can change the pattern. So the question becomes, which number predicts danger? The top number, systolic, the bottom number, diastolic, or the gap between them, pulse pressure. Let's make this simple. I'm going to cover 1. What each number actually means. 2. The most dangerous patterns for seniors. 3. The red flag thresholds you should not ignore. And 4. What to do next, step by step. When you see a reading like 150/80, systolic, top, equals pressure when the heart contracts. Diastolic, bottom, equals pressure when the heart relaxes between beats. Now, here's a key point that's often missed. The systolic number is heavily influenced by arterial stiffness. The diastolic number relates more to the resting tone in the arteries and, importantly, the pressure available for coronary artery filling. The heart muscle gets blood flow during diastole. Pattern interrupt. So in seniors, it's not always top bad, bottom fine. Sometimes a too low bottom number can be a problem too, especially with certain symptoms or existing heart disease. The short answer, but with nuance. Which number is most dangerous over 60? For many adults over 60, the number most strongly linked to stroke risk and vascular events is often the systolic top number, especially when it is persistently elevated. Why? Because with age, the top number can rise due to stiff arteries, and that increased pressure is strongly associated with stroke risk, heart failure risk, kidney strain, and vascular damage over time. Myth versus reality. Myth: if my bottom number is okay, I'm fine. Reality: a high systolic number can still be high risk, even if the diastolic looks normal. But here's the part most people miss. The most dangerous situation is not simply the highest top number. It's the highest number with the wrong context. Plus, if your top number is extremely high, think 180 or higher, that's in a zone where we stop thinking routine management and start thinking, is there immediate risk? This does not automatically mean catastrophe, but it does mean you should take it seriously. Here's the practical approach. 1. Sit quietly 5 minutes. 2. Recheck using correct technique. 3. If it stays very high, evaluate symptoms. We'll cover red flags soon. If this sounds like you, seeing a scary number and immediately rechecking 5 times in a row, pause. The goal is a clean recheck, not an anxiety spiral. Dangerous pattern. Number 2. High systolic plus wide pulse pressure. Let's talk about the gap between the numbers. Example: 170/70 is a gap of 100. That's a wide pulse pressure. In many seniors, a wider gap can reflect arterial stiffness. This pattern can be associated with higher cardiovascular risk over time. Now, here's the important nuance. A wide pulse pressure doesn't automatically mean emergency today. It's more like a sign that the arteries may be stiff, the systolic is running high, and you need consistent tracking and clinician guidance. What to do? Track a 7-day average. Bring the log to your clinician. Ask, is my systolic consistently elevated, and what target range should we use for me? Dangerous pattern. Number 3, diastolic 2, low. Yes, low can be risky. Now, let's address the bottom number, because this is where seniors get confused. If the diastolic becomes too low, especially below about 60, and you have symptoms or known coronary artery disease, this can matter. Why? In simple terms, coronary arteries often fill during the relaxation phase. Diastole. If diastolic pressure is very low, some people may not tolerate aggressive blood pressure lowering, especially if the systolic is still high. Myth versus reality. Myth: lower diastolic is always better. Reality: in some older adults, very low diastolic plus symptoms can be a warning sign that the current BP plan needs reassessment. What symptoms matter? Chest pressure with exertion, unusual shortness of breath, lightheadedness, fatigue that feels new or out of proportion. Important: don't self-adjust medications, but do bring this pattern to your clinician. The most dangerous number depends on one thing: symptoms. Here's the rule I want you to remember. A high number without symptoms is usually handled differently than a high number with symptoms. A generic story vignette, not a real patient. Imagine two people, both 70 years old. Person A sees 182/92 at home, but feels okay. They sit, recheck correctly, it drops to 168/86. That becomes a call the clinician, adjust the plan, track averages situation. Person B sees 182/92 and has chest pain, shortness of breath, confusion, weakness, or a severe unusual headache. That becomes an urgent evaluation now situation. Same number, completely different urgency. Red flags. When a BP reading is an emergency, seek urgent medical care right away. If you have very high BP with symptoms like chest pain/pressure, shortness of breath, fainting, severe headache that's unusual for you, confusion trouble, speaking sudden weakness or numbness, especially one-sided, vision changes. And if you ever have stroke symptoms, face drooping, arm weakness, speech trouble, treat it as emergency care immediately. So, what should seniors focus on, top or bottom? Let's answer the headline clearly. For many seniors over 60, persistently high systolic top number is often the major driver of long-term risk, stroke, and cardiovascular events. But very low diastolic, bottom number, especially under approximately 60 with symptoms or known heart disease, can also be a risk pattern and a reason to reassess the treatment approach. The most dangerous reading is often the one that is extremely high or high with symptoms, regardless of which number it is. Now, let's make this actionable. Here's what I'd do, step by step. Step 1. Check technique. No caffeine/exercise/nicotine for 30 minutes. Sit 5 minutes. Back supported, feet flat, legs uncrossed. Correct cuff size, arms supported at heart level. Step 2. Take 2 readings, 1 minute apart. Record. Both. Step 3. Look for patterns. One high reading is data, not a diagnosis. Look at a 7-day average, morning plus evening. Step 4. Escalate appropriately. High plus symptoms equals urgent evaluation. High without symptoms, but persistent equals call clinician, adjust plan, review meds and triggers, what to bring to your appointment segment. To make your next appointment productive, bring a 7-day BP log with times, your device brand/model, your medication list, including OTCs like decongestants, NSAIDs, supplements, notes on sleep, alcohol, stress, pain, and hydration. And ask one of these questions. Is my systolic consistently above my target? Given my age and history, what's a safe diastolic range for me? Do my readings suggest morning spikes or evening spikes? Should we evaluate for secondary causes if this is resistant? Over 60, high systolic often drives long-term risk. 180/120 range is a serious threshold. Recheck calmly and assess symptoms. Low diastolic, 60, can be concerning if symptomatic or with known heart disease. The most dangerous reading is high BP plus red flag symptoms. Track a 7-day average, don't chase single readings. Comment your typical pattern, higher in the morning or higher in the evening, and your most common reading range. Example, 145/78. That helps me choose what videos to make next. Next, I'm going to cover why blood pressure stays high even on medication, and the common hidden factors, including OTC meds and sleep issues, that can keep your numbers up.